What's up, y'all? It is Dr. Mia, your B3 specialist and board certified gynecologist at Bella Wellness Center, where we offer gynecology to women and adolescents of all ages, as well as total wellness solutions to help men and women live well, age well, and experience everlasting intimacy. So, today we're going to talk about cervical cancer awareness and the things that you can do to prevent cervical cancer. Cervical cancer used to be one of the most common female cancers and still is worldwide. However, in the United States, secondary to our screening tool, our amazing screening tool called the Pap smear, PAP for short, because it's a long word. Secondary to that, now we are preventing cervical cancer. So the rates of cervical cancer in the United States have decreased significantly since the creation of the pap smear. And the pap smear is a part of the annual exam for women who still have a uterus and a cervix that are under the age of 65. Usually, we recommend you start having your pap smear screenings at the age of 21, whether you're sexually active or not, because HPV is everywhere. It's like all over this room. I'm in a GYN office, so it's all over every patient room. Men carry it under their fingernails. It's just everywhere. It's prevalent in the population. So at some point, we know everybody's going to get exposed. That exposure can do nothing. It can cause a benign process called genital warts, or it can cause abnormal cells on your cervix that, if not treated and recognized early, could turn into cervical cancer down the road. So the reason we do pap smears is to make sure that when you're exposed to human papillomavirus, you are not having changes to your cells that could lead to cervical cancer. So getting your pap smear once a year starting at the age of 21, unless we tell you less frequently or more frequently based on your history, but you should be going and getting your annual exam, your well woman exam. That includes your breast exam, your bimanual exam, your vaginal exam, your pap smear sometimes, as well as screening cultures, all of the things. So pap smears everywhere, anywhere from every 1 to 5 years is what the recommendations are. But for me personally, I recommend my patients have a pap smear every 1 to 2 years. And if they're HPV negative, I may let them go up to 2 to 3 years. But we determine that based on your history, based on your sexual function, based on your lifestyle, based on your history of pap smears, based on your immune system. So for some people, they're going to get them more frequently. If you have an abnormal pap smear, just know that that is not a big deal as long as you follow it up and do the appropriate treatments from your physician. So the point of the pap smear is to prevent cervical cancer so we can recognize slightly abnormal cells, monitor you closely with more frequent pap smears, sometimes a procedure called a colposcopy. Sometimes we have to remove the cells. That's called a LEAP. But we can prevent cervical cancer. So as long as you're getting your pap smears on a regular basis, you should never get cervical cancer. So go see your gynecologist once a year, and you and your gynecologist should decide whether or not you need a pap. For those women who have had a hysterectomy and no longer have a cervix, they may not need to have cells sent, especially if they didn't have a history of abnormal paps 3 years prior to their hysterectomy and they had three normal paps prior. Um, those women may not need a pap smear. Women who are over the age of 65 and they're low risk without a strong history of cervical cancer or abnormal paps can still not get pap smears anymore. So those are situations that you should be discussing with your doctor to see what are the real recommendations for you. My recommendations are a little different from some of the other recommendations because I'm a little bit more conservative, because I have seen women come in for a normal pap, come back and do a pap the next year, and they have an abnormal pap and then it's cervical cancer. So it can progress sometimes quickly. So that's why I'm conservative and I make sure I monitor the cells on the cervix closely, because pap smears prevent cervical cancer. So it's Dr. Mia at Bella Wellness Center. I'm super excited about our 3-day experience. It's coming up January 16th through the 19th. You can register and sign up for the free webinar. I'm going to have some experts on my actual 3-day experience so that you learn all about mindset. You're going to learn about exercise and the right way to exercise over 30, as well as emotional eating. We're going to discuss that with the psychiatrist. So hope to see you there. Hope you learned something today. Share this post with everybody who want to prevent cervical cancer. It's one of the most preventable cancers in the United States. So we want to make sure our ladies are having their pap smears and their normal screenings like they should to prevent this cancer. It's Dr. Mia. Y'all have a great day. Bye.